This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Hello, good afternoon. Welcome to Tom Roselle Live. You are listening to a different voice than you're used to. This is, my name is Dr. Matt Adams, and I am stepping in for him. Today he is hosting a major conference. He's got multiple doctors coming into the D.C. area, celebrating 50 years of applied kinesiology, and he's actually speaking right about now to them. So you're going to listen to my voice, and along with my host here, Dr. Stephanie Pina, and we are here to talk about the different problems you may have, health conditions that you've been seeking advice for. You've been around, you've been to other doctors, and you need another approach, and this is the place to get it. We have a great topic today. It is finally summer. It still feels kind of like spring. So when I think of spring, you think of things blooming, things are coming alive. We have a topic that goes along with this, a topic that I think a lot of people are interested in but may not necessarily want to discuss, but applies to all of us, a topic called fertility. And Dr. Stephanie here is going to be your host, your presenter, and we're going to discuss some of these things. And before you say to yourself, well, this doesn't really apply to me, I'm not really thinking about being fertile or having children, Dr. Stephanie, let us tell some of these listeners that, hey, this is not just for a small percentage of the population.
All right. Well, thanks for having me on again. Exactly. A lot of people kind of go, you're either in your fertile cycle or you're not in your fertile cycle, and it's either something of interest or not. But it's amazing when patients come in, young and old, how often they either know someone or have had to deal with this issue, because even though fertility is about having children, having babies, what's working for people and regulating that, it's also about just transitioning through any kind of life process, a cycle, and this goes for men or women. This can go from everything for women, from puberty on through their reproductive years and even, into postmenopause. For men, this has to deal with, the andropause that we're talking about too. There's that transition, same thing's happening. So really when we're talking about fertility, we're talking about that cycle that's changing. Things are not just about how to get pregnant. And essentially it's about how you're changing hormonally, how things are changing as far as stress and the effect that it has on the body. So a lot of what we're going to talk about is going to be specific for both men and women during those reproductive years, but not necessarily just related to that. How the body is also dealing with different types of stressors and how it affects basically endocrinology in the body too.
Yeah, the hormones are constantly going through different changes, whether it's by age, whether it's by season, whether it's by temperature, whether it's by stress. And so the overall health in the body is regulated by a lot of these hormones. And so you have to not only think of fertility as, like you said, being able to have proper hormone balance to have a child, but as we get older and things change, we want to make sure we have proper hormone balance through the rest of our lives, whether before or after, so our bodies can function the way they're supposed to. There's constantly, I'm hearing about patients and different people who have all kinds of different symptoms related to different hormone imbalances that, you can look at and see, okay, this definitely applies to that particular person.
Well, essentially what you're talking about, too, is really looking at where we are in our life, what is the purpose of everything that's going on, and how are different stressors affecting us. When we're in our 20s, our stressors are a lot more different. It's about, how do I choose what I want to do for the rest of my life? How do I find a partner? How do I, basically not have to eat rice and beans and can financially afford to live the lifestyle I want to live? And you move in more into your 30s and 40s, and then you start going, well, how do I maintain the lifestyle that I want to live? Now is the time to start thinking about children. Do I put my work first, or do I worry about, making money, or, do I worry about when am I going to start a family? And then what tends to happen with, people is that they tend to, we're in a society that basically drives the workforce. So we want to strive and achieve. And so you're seeing people who are interested in starting a family start a lot later in life than they used to. Now, there's benefits and pros to that because they're a little bit more mature and they can handle things a little bit better, but their stressors are different. Their body reacts differently. So a lot of times people come in and they're dealing with some of the same issues that we've been talking about through all these other shows, adrenal stress, digestive support, fatigue, and basically even sleep issues. And what's happening is that they'll come in for those issues and then start putting their own health priorities on the line and start going, oh yeah, and there's this thing. I kind of want to have a family, but I don't know, one, if it's possible, because I've been told I'm over the age of 35 and that everything goes downhill then, which is not true. And essentially they start going, well, what am I going to do about that? So they come in for one issue, and the amazing thing is a lot of times people get better and are able to become more fertile even though they have fertility issues when you start correcting the rest of the body. So fertility is not just about your reproductive organs and hormones. It's essentially about lifestyle. It's essentially about how do you keep everything in balance. And whether you're using Western medicine or, Chinese medicine like I practice, there's always a balance between getting that information and figuring out what's the best thing for you and how your body is responding to things.
Yes, Dr. Stevie is going to get in much great detail. She's hosting a talk at the Roselle Center on the 25th, Wednesday at 7 o'clock p.m.
7:30.
7:30. I'm sorry. Thank you for correcting me. If you want to get there at 7 o'clock, we'll still be there, I promise. If you want to make reservations, please give us a call, or give the clinic a call, 703-698-7117. Get your seat. They fill up fast. Be there to learn more about this particular topic. So I've from a chiropractic standpoint, I've experienced this or seen this before with patients coming in. They're coming in for a back problem, maybe a car accident or something, and then you find out later that they have been trying to get pregnant for 2 or 3 years, and all of a sudden they're able to get pregnant after you start working on a back issue. And we were having a conversation before that you have, I believe, seen an article from a similar standpoint, but from, an acupuncture standpoint there.
Well, there's a lot of information and a lot of research out there, especially since there's a major research article on acupuncture that came out in 2002 that was discussing a research study where acupuncture was used before and after embryo transfer to improve success rates for pregnancy and live births. And since then, more research has come out, but that article started to get people thinking about what effect does acupuncture have on the body. Now, it was actually done after research that was done in 96 that essentially was using acupuncture points on the low back that are typically used for low back pain patients. But it was affecting the nerves basically in the lumbar back that was going to the reproductive organs. And we talk about all the time how, there has to be proper alignment. The nerves have to be functioning and firing correctly in order to affect not only the structure and the muscles, but also the organ systems. The same thing goes for fertility. So changes in those particular areas by using acupuncture points or even adjustments can basically help affect the reproductive system so that you can have more of a chance to have children, work with infertility, and essentially even change other issues that might be happening related to a menstrual cycle, like cramping and PMS and stuff, because the body's able to control that particular cycle a little bit better. So there's a lot of information that's not always out there for everyone, but you see this happen over and over again in clinics, and it speaks for itself.
Yeah, so you help the body, get more balance. You help it, work the way it's supposed to. And then all these other issues that maybe you didn't even think about start to work better. It's amazing, and that's what when you look at hormone balancing, a lot of people are looking for a lot of times like a quick fix, but a lot of times the imbalance is something that has been taking place over a long period of time leading up to that point.
Absolutely. And, we look at lifestyle factors such as, being overweight or underweight. What is someone consuming? If you're trying to get the body ready, whether you're trying to have a baby or trying to, run a marathon, or you want to make sure that body's in the best possible shape as possible. So looking at other things like the digestive tract is really important, and we forget. We don't think about weight and nutrition in the food that we bring in and how it gets absorbed other than is it good or bad for me. You hear a lot about, I should eat this kind of fat and that kind of fat. Well, those fats are really good also for hormone production. They're good for maintaining body weight, which has to regulate hormonal cycles. And part of those cycle has to deal with producing follicles and eggs and also producing sperm. So you're looking at the hormones needed to basically drive sexual function, but then you're also needing to basically help regulate everything that's going into the body to stimulate it for growth and development as well, too.
Well, it looks like we've already got some calls. So why don't we go ahead and take this call here? Is Laura?
Yeah, hi, Dr. Roselle. Thanks for taking my call.
Hello, Laura. What can we do for you?
Okay, I have a question. Are you familiar with Dr. Shandon Thompson? He's a chiropractor, and he talks about the SDR method treatment for the back, for back problems, discs, and everything else. So I don't know what this SDR method is. He sent me a report because I asked for the report, and then he uses the XYZ treatment to make discs healthier. I don't know how these work, and if you're familiar with it, could you please give me just a brief idea about those methods?
Now, you said this was a chiropractor?
Yeah, his name is Dr. Shandon Thompson, and he's the developer of the SDR method treatment.
Okay, so, SDR usually stands for selective dorsal rhizotomy, which is a surgical procedure. So I'm not exactly familiar which treatment option he's wanting to speak about from a chiropractic standpoint, because he would not be able to do surgery if he was a chiropractor.
No, he doesn't treat people with surgery. In fact, he said these are options without having to do any spinal surgery.
Okay. Well, to be honest with you, I'm not exactly familiar with that particular type of treatment or type of technique that he uses. I do know, if you've not been to a chiropractor before, that there's many other options that can help you with your lower back. We do a lot in our clinic in regards to...
Okay. What about spinal stenosis?
Spinal stenosis. So we do see many patients with spinal stenosis. Spinal stenosis it means that the hole where the nerve is coming out of has decreased in size, whether it's due to a bone spur or some degeneration or disc protrusion in there. And so there's many different techniques you can do to help open that up, and why not without having to do surgery?
Yeah.
So there's a lot of options for you. If you're looking for options, there's a lot of things. Acupuncture is very helpful in that as well.
The reason why I called you is because I don't want to go and see a chiropractor, and I don't know much about him and his methods, and I don't know if they're going to help or not. So I tried to email you last week, and I couldn't get through. So what is the best email site for you, Dr. Roselle?
Well, if you can get a hold of our website at rosellecare.com. You can email us at rosellecare@aol.com.
Yeah, or you could do info@rosellecare.com and then simply just mention your name, Laura, and that you had this issue, and we'll make sure that we can check the emails for you and get back to you as well, too. Because obviously, like Dr. Adams was saying, too, there's a lot of different techniques, and it kind of depends on what's going on with your particular back pain. Because certain techniques it might make it worse as well, too. So you want to make sure that you get as much information as you can, which is exactly what you're doing. So you're on the right track.
Yeah, okay, thank you so much.
All right, thank you for calling.
I'll try to email you this week, Dr. Roselle.
Yes, send us an email. I'll be happy to get back to you. Well, it looks like we're coming up on a break right now. If you have any questions, please give us a call, 888-630-9625. We'd love to talk to you, love to talk about some of your problems, and we'll be back here in just a little bit after this break.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
All right, welcome back to Dr. Tom Roselle Live. You are listening to Dr. Matt Adams live here in studio with our special guest, Dr. Stephanie Pina. Now, we are talking about fertility, issues with fertility, and we're talking about the hormone balancing leading up, and that comes after the fertility, and we've talked about some different things. I mentioned low back. I mentioned some of the areas in the spine that can affect it. I want to talk a little bit about and help some of the people listening, help them understand from a Chinese medicine perspective, from acupuncture perspective, and from treatment. What are some of the things that is done that has been developed that you have studied and that you do with some of these patients with these problems?
So Chinese medicine, which includes acupuncture, it includes herbal therapy, it also includes diet and exercise as well, has been treating, gynecological issues for over 2,000 years. There's lots of old school texts on there that basically have said, the first thing you start with is you regulate the cycle, and basically you have to warm the body up so that you can prepare it for any kind of pregnancy or any kind of hormonal changes. And so there's been a lot of information that's been put out there, and more recently, a lot of the research that's been put out that tries to understand how acupuncture works just for any condition really can apply to fertility and hormone balance as well. When you look at acupuncture from a standpoint, what is it really doing is improving blood flow, first of all. And that's one of the main things, because we know the hormones are in the blood. We know we have to get circulation to organs that we want to function well, whether that be the uterus, or the testes, or the digestive tract, or even the mind. Essentially, what we want to do is we want to improve that blood flow. So anytime you put an acupuncture in, whether you're treating pain or infertility or insomnia, you're basically improving blood flow to a different area.
Okay, so that's kind of what you mean when you said warming the body up.
Sort of. Okay. That's one way.
Okay.
That's one way. But basically, when you're moving blood flow to the reproductive tract, you're going to affect its functions. So if someone's coming in and they have an irregular cycle, or they've had lab testing done with a fertility center, or even just their general OBGYN to see where they are in their cycle. A lot of women come in and they have FSH levels, which is follicular stimulating hormone, which can be an indication of how fertile you are for the first half of your cycle. At the same time, it's used also to basically see if you might be getting to be closer to menopause as well, too. So lots of women get this done. But essentially what it's doing is that's a stimulation that acupuncture can kind of help, because you're improving the brain's response and the hormones it releases to basically the adrenals and the ovaries, so that it knows how to turn on off. So you can use acupuncture to help stimulate that blood flow to the uterus. And if someone's even getting conventional medicine treatment, we work well. Acupuncture has been shown to work very well and improve success rates with people who are going through different procedures like IUI, IVF, embryo transfer. So even if there's unknown causes for fertility, you can still work with the patient depending on where they are in their cycle. And especially you have the patients that want to come in and work on not only their whole body, but essentially you have ones that want to work on maybe having a natural cycle and not have to use any kind of stimulation drugs, want to be able to try to get pregnant on their own for whatever reasons, whether it's they're not at that point where they want to go in there. It can be a financial burden as well, or even sometimes ethically or religiously there's issues for reasons why couples don't want to do IVF. But there are certain things you can do to help regulate the body first. And there's even take-home stuff that I try to get my patients more involved with their healthcare, so they're not just thinking I'm just going in and getting acupuncture done, or I'm taking some strange herb to basically improve my fertility, but they want to know why they're doing it, and that's what we're going to discuss.
Okay, so basically what you're saying is you can help people who just want to go that route and don't want to take any medications, don't want to go regular medical route, but also people who have tried, they are, like you said, doing IVF, they're doing these other fertility treatments, they can still get benefit by seeing you. They can do those together.
Absolutely. And a lot of times that's where patients are coming in if it's just fertility that's bringing them in, because they've been trying, they did lab work, they know what their estrogen levels are, they may have had ultrasounds and ruled out different causes of why they might be infertile, if there is a known cause, because sometimes, anywhere between 10 to 15% can be unknown causes. That's the great part about acupuncture. Sometimes those unknown causes are exactly what they need to be treated. And an unknown cause could be stressors as well, too. And unfortunately, when you're just working with an IVF cycle and stimulating drugs, you're not really paying attention to what the stress response is. So we'll have patients that come in that have everything already lined up. They're working with fertility clinics, and basically some of the protocols that even have been put out there, the baseline of it is to work on their stress response to make not only, and I say the couple because usually the woman is the one that always gets all the treatment, and that's important, but everyone gets stressed out. This is a stressful thing. So they can come in and get de-stressed before and after treatment and go from there too. Yeah, so, it takes two. It does.
So, Dr. Stephanie Pina, our host this Wednesday, 25th of June at 7:30. If you heard me wrong earlier, please call 703-698-7117. Get your seat, get your availability. Doesn't hurt to talk about this. We're going to take a break. We'll be right back. We're going to talk about some of these causes that are causing these problems leading up to these fertility issues. So come right back. Come listen to us.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
We are back. This is Dr. Tom Roselle Live. You're listening to Dr. Matt Adams and Dr. Stephanie Pina here talking about fertility and the issues there. Now, if you have questions, please give us a call, 888-630-9625. Any questions, any health problems you may have, give us a call. We'll see what we can do to help you, to put you in the right direction. Dr. Stephanie Pina is going to be discussing this topic at the clinic Wednesday evening, free for the public. Great information on the 25th at 7:30. So give us a call. Give the clinic a call, 703-698-7117, and reserve your spot so you can be there, so you get this information. Now, speaking of reserving your spot, getting information, Ageless Health 2014. It's the big conference that Dr. Roselle puts in every year with tons and tons of information. The doctors speak about many different topics. Coming October 18th. Reserve your spot for that. It's going to be an amazing day. It's a full day. We're going to feed you. We're going to give you information. We're going to give you exercises. We're going to do presentations of many different things. Come to that. You want to be there. You want to learn. We're going to give you notes so you can remember, so you can have all the stuff that you try to remember, because there's so much information, but it's amazing. Now, Dr. Stephanie, what I want to do is talk about, now there's a lot of different acupuncturists and acupuncture treatments. I treat a lot of patients that go to different acupuncturists, and I know that you have some very specific training in this particular topic that we're discussing. So I want you to talk to the viewers and kind of explain to them some of the training that you've had and the studying that you've done that will allow them to understand that you really know and you have experienced this and you've researched this quite a bit to know what they need.
Sure. Well, I originally started out as a naturopathic physician in Arizona, and we were seen as primary care physicians, and the line of work that I did was in women's hormones. And when that originally started, I had no idea where that was going to send me, but we had to deal with a lot with bioidentical hormones, how I saw a lot of perimenopausal patients kind of coming in. And as my acupuncture practice grew and I moved here, I realized that I was actually seeing a lot of fertility issues come in and younger women who really had questions about how they could either become pregnant later on, or I had parents or godparents who were saying, you know, I know someone who's dealing with this. So as an acupuncturist, there is a specialty board called the American Board of Oriental Reproductive Medicine. I'm now a fellow of that board. And essentially what it is you are on the board to basically see yourself as a specialist in reproductive medicine. And that requires knowing what's the latest research out there from the Western medicine perspective and from the Eastern medicine perspective. So knowing what research trials have been going on, understanding when a patient goes into a fertility clinic, essentially what's to be expected. So a lot of times I have conversations that have to deal with what their appointment in the IVF clinic is going to be like and what questions they should be asking in order to get them more informed to say, you know, which options are going to be the best ones for me. So a lot of that training includes not only the acupuncture portion, but knowing which herbs are safe to use, which herbs are safe to use during pregnancy, and also to know which times are the best times to try to get pregnant and give people the best information. So acupuncturists will do very similar protocols as far as improving blood flow, like I said, to the reproductive organs, but there are specific ones that you can do that are going to be really focused on certain times during the month that are also going to help with men and increasing sperm production, sperm motility, and also looking at nutrition. How can you input sources in there and how to basically prescribe those correctly as well. So the specialty board is really important because I think patients understand that they are getting a different type of acupuncture treatment than they normally are. So yeah, that's the ABORM has been around for about 10 years now, and essentially they have some of the top docs in the nation, also in Canada, are on that board and across the world, and essentially there's very few even in this area that have that specification. So having it's a good thing. I think the more you know as a physician, the more you can help many patients and kind of understand where they're going through and what the complications and what they have to go through and understand them, especially during this stressful time.
Well, no, I think that's really important because a lot of these patients are going to be familiar with hearing things like, you know, like you said, FSH, LH, estrogen, progesterone, all those balancing, trying to get those balanced. And, you know, sometimes you may think, well, if I go to acupuncturist, you know, they're going to talk about blood flow like you talked about earlier. But it's important to have both sides of those, especially, like you said, if you're going to be co-treating with another physician or co-treating to help them during their IVF treatments, to be able to explain to them both sides.
Yes.
So they get that. And
what's interesting now is you also see it goes both ways too as well, because you have reproductive endocrinologists who are the specialists that you talk to in like the IVF clinics, the fertility clinics. Those are the people that are working with you, and embryologists who are there when it comes down for embryo transfer time and stuff. They are open now to having acupuncturists even on their site where they do some of these procedures and acupuncture procedures on site right before and after, because they recognize the effect it has. They've seen the research. So this isn't a completely out of the park kind of idea. They understand it. We have a research clinic an acupuncture clinic, IVF clinic, right nearby us that has had acupuncturists on site that we refer to us. And essentially it's great because we know what we're doing and vice versa. I can have that conversation with them and kind of talk to them in their language, and then also have that conversation with patients so they understand that I understand what's going on over there. So a lot of times that's the part that gets left out. So you have to be able to sometimes have someone that you can ask those difficult questions to, as far as how do you explain some of the technical stuff, and when do you do hormones, and when do you do herbs, because a lot of times, I agree with the reproductive endocrinologist, because if you're trying to do all this stuff, you don't want to go against what you've already had done. You don't want to do something that's going to stimulate different hormone cycles when they're being regulated by stimulating drugs. So you really need to know what you're doing instead of just kind of going, well, we're just going to treat you and see what happens.
Yeah, and start, butting heads with hormones, and that's not a good idea, because then you can cause other problems, and then you don't get the outcome that you're looking for. Well, we have, let's go to some of these calls here. We have, looks like Barbara here in Silver Springs. Barbara, what can I do for you?
Hi.
What can we do for you?
Yes, thank you for taking my call. We are in a predicament having to make immediate decision. My husband has a hernia that's coming down. He's had this hernia many years, but now, it's progressively to the point where the primary doctor and a hernia surgeon says it should be treated as quickly as possible to push it back up and close the opening. If you don't do that, it might burst and cause major complications. And it's a very minor outpatient operation in and out. And I'm not comfortable with operations. So would you give me your options as what to, whether to go ahead, or are there better options?
Well, when it comes to a hernia, there is a lot of risk with having that opening in the musculature, because the intestinal tract can slip out and get pinched and cause some major issues. So in that instance, we're very conservative for most things, but hernia is typically something you don't want to play around with. And for most of my patients that I've had, actually all of them that I've had present to me with a hernia, that I've advised them that they need to work with their primary care doctor to get that taken care of. Now, there's a lot of things you can do afterwards to strengthen the core muscles, to strengthen the pelvic muscles, to help it to heal quicker from an alternative standpoint, to help prevent it and improve the healing process. But with a hernia, that's usually something you want to work with your primary care physician and follow that. Otherwise, there's other things. I know it's maybe not the answer you wanted, but that's the direction that if it was me, that I would go.
Okay.
In that way.
To get the operation.
Yeah, that's the best way to fix that, because otherwise you can't really fix it without the operation. You can try to strengthen muscles around there, but it's no guarantee that something's not going to slip through and cause a major problem, like your doctor said.
Oh, okay. Well, that gives me a good direction. Thank you.
You're welcome. Thank you for
much.
calling. Let us know if there's anything we can do to help you or help him during that healing process afterwards.
All right. Thank you.
And now we have Ruth here. Thanks for holding, Ruth. We appreciate your patience.
Oh, thank you, Doctor. I wondered whether there is any cure for ulcerative colitis with acupuncture.
Sure. Ulcerative colitis obviously is inflammation you see in the lower digestive tract. It can come in a number of different stages, so a lot of times it depends on what someone's been doing as far as current treatment and what symptoms they're having. One of the main things that I have patients when they come in, they're usually on a pretty strict regime of some pretty heavy dose drugs and medications to decrease inflammation. One of the main things you want to do when you're trying to use acupuncture for this is you're stimulating blood flow to the area to help healing, but you have to realize you have to treat what the inflammation was to begin with. Now, colitis can also be seen as an autoimmune disease, so your immune system has to be boosted as well, too. And when you boost it, you're not trying to get it to overreact and make things worse. You're trying to basically kind of calm it down in this area. So improving blood flow to the digestive tract and also making sure that from the upper digestive tract that you're actually bringing in nutrients and stuff is something you have to do. So it can kind of help with relief. It kind of depends on where they are in their cycle and what they're doing. But you can see some definite changes as well too. But diet and nutrition and looking at boosting the immune system has to be included as well too. So it's not just a one needle cure, as we call it. Basically, you have to kind of look into what else is going on in the body and why, for this particular person, their gut is the area that they're having the most inflammation.
Yes, I'm not on any medications. I'm just trying to watch my diet.
Mm-hmm. Yep. So basically, I mean, it's kind of funny. We talk about food sensitivities and stuff here a lot, and I'm not saying that that's the only reason why colitis starts, but when we have sensitivities to certain foods, it can be the good stuff too. I mean, I had someone the other day that was like, I was told I was sensitive to broccoli and I was supposed to eat broccoli all the time. So there could be things that we eat on a common basis that kind of basically are continuously irritating the system. Looking at bowel health is a really important thing. So when you're not on the medications, it's easier to kind of see and work with stuff because you don't have that medication blocking some of the results that you can possibly get. But there's a lot of other little things that we have to find out. So what I would do is contact a clinic, either send us an email at info@rosellecare.com or give us a call and come in so we can really sit down and discuss some of this, and then we can really come up with essentially some of the options that you have as well, acupuncture, diet, and going forth.
All right, thank you.
Thanks.
That's a good point. I mean, you've got someone like that with colitis and some, digestive problems, that's definitely going to play a big part in what you're trying to do to balance the whole body, help it to heal and work so that the hormones can balance, whether they're trying to, have a child or afterwards trying to bring balance to their system to, help out with who knows what, hot flashes or menopause or all those things. I mean,
we you hear over and over us talk about the effect of inflammation, the effect of inflammatory substances in the body, and how too much of a good thing is not a good thing. Everything in moderation. And sometimes we can figure out what those inflammation substances are, and we can't. Autoimmune diseases are one of the ones that you see affect a lot of different things in the body that affect, say, fertility. I mean, thyroid disease, whether it's running high or low, hyper or hypo, can have a great effect on the reproductive tract and the endocrine system. It can affect the adrenal glands with adrenal fatigue, chronic fatigue, because your adrenals are also involved with making some of those same hormones that we need for reproduction, that we need for metabolism. So you have to basically go in and not only look at what's causing inflammation, but how is each individual body experiencing it, and then go from there. One of the keys that you don't hear a lot about is you have antibodies sometimes to different hormones and also to substances like their sperm antibodies. And so basically the body rejects the sperm that's being used for fertility. And so there's medical treatments where, like stuff like IVF, where they can basically kind of cut out some of that factor by introducing the sperm and the egg into a petri dish and then reinserting it. But the body is having these responses because something's not right. And trauma can be one of the main things that creates inflammation. And from there, the body's just trying to recoup and recover, but it kind of goes haywire. So there's a lot of things when you're taking a history on someone who has to do with any kind of hormone problems, any kind of fertility problems, sexual performance problems, that may not be related to or they might not think it's related to the actual thing they're coming in for, but can be some of the causes.
So you're saying that the body, like the woman's body or even the male's body, they could be attacking their own sperm,
Correct.
Essentially. Okay.
Yes. And that can go for men or women. And that's a tough one to kind of change because you can work on the immune system, and this is where using Western testing is actually good because they can help to identify this. And this is where you need some of the specialists to give us feedback so that we can try to approach it more naturally and figure out what's the best procedure for this. But essentially, that's just one of the main causes. I mean, you can look at a lot of different things like decreased blood flow or too much blood stagnation, like with things with endometriosis. You have blockages, and the body's basically got areas of inflammation, so it's trying to cover those up and deal with basically uterine tissue outside of the uterus that can affect digestive health, that can affect neurological health, and it makes it tough to become pregnant. Things like PCOS have to deal with basically digestive issues. There's too much testosterone. There's an imbalance with cortisol levels and with insulin levels. So now you're looking at something that looks almost like a pre-diabetic issue, but it's affecting the reproductive tract. So a lot of times it's a lot more complicated than just where's my hormones, what am I doing, where's my temperature on my basal body temperature chart, and go from there. Got to look at the whole body. It's all affecting each other. Well, we're coming up on another break. Stay with us. We'll be right back. Talk to more about this great subject, fertility, and don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Hello, this is Dr. Tom Roselle Live. You are listening to Dr. Matt Adams sitting in for him while he is out sharing his knowledge with the world at a conference right now. I'm here with Dr. Stephanie Pina, our special guest. We're talking about fertility. She's our host on Wednesday evening, June 25th at 7:30. Give the clinic a call, 703-698-7117. Reserve your spot so you can get more information on this and how you can improve your health. Now, we have a caller who's been waiting patiently, Bernice. What can we do for you, Bernice?
Oh, hi. I have a question. I was listening to the lady who has her husband needs hernia surgery, and I was thinking about my cousin who had cancer surgery, and they went through adrenal glands, and she had cancer, so they went in and they found out the cancer spread, so they took out the kidney. And then they put tape. So when do they use tape and when do they use stitches? Because she ended up getting 2 hernias after the cancer surgery, and they had to go in immediately and put in more tape, stronger tape, and then they went in and they stitched her up the 3rd time. And she ended up dying. But I don't know if it was the cancer or too many surgeries, too much pain, I don't know. But when is it logical to use, tape versus the stitches?
Well, a lot of times, essentially, it depends on what they're working on. If they're going in, especially around the kidneys and around internal organs where, I always think about there's areas of a lot of movement, a lot of blood flow. You want to make sure with stitches, they're essentially going to use the right form to basically hold everything together, and they want to keep things so that it gets proper blood flow. When you talk about things like surgical tape, a lot of times it's more of not a temporary fix, but you're not going to get the same kind of response that you do with stitches. So stitches usually are a little bit more heavy. So in this situation, it sounds like there were other complications, especially if she passed away. But essentially what you would kind of have to do is essentially rely on what the surgeon's doing, because I usually don't have a choice on these two. But essentially, the surgical tape, you'll see it for us a lot of times. You'll see it outside, and basically what it's doing is trying to hold and support an area, and that works out well because essentially what it's doing is giving support so that the body can heal itself, can absorb the stitches that are internally, but there's still function and flow. So surgical tape helps as almost like a supportive measure versus trying to do what stitches do and really hold things together.
All right, thank you for your call, Bernice. We appreciate it. Now, Dr. Stephanie, your talk's coming up this Wednesday. Tell the audience listening to you here why they need to be here, what they're looking for, what they can look forward to, and what they're going to get out of this presentation you're doing.
So we're going to talk about fertility, not only just the lack of, but it's also open to anyone who really wants to know about that particular cycle in their life. We're going to address the Western side, the conventional side, and also the Eastern medicine side. How does acupuncture help out? How does the research, what does it show? Where are the benefits? And how do you know what are the best things to do in your typical life? So if you or anyone else who has any questions about this, please let them call in, 703-698-7117 to basically sign up for this. And we have a lot of information that will help explain where you are in that process.
So pick up your phone, dial that 703-698-7117. Be there 7:30, 25th of June. Dr. Roselle will be back next week, and then if you're interested in hormones, Dr. Lamp will be here the week after talking about male hormone problems. Thank you for listening. We appreciate your calls and everything. Have a wonderful day.